Hello, my name is Emily Thurlow, and I am presenting my study proposal on postpartum depression screening. Some more information about me. I am currently a graduate student at Regis College in the Women's Health Nurse Practitioner program. I graduated with my Bachelor's of Science in Nursing in 2018 and spent the first 4 years of my nursing career working on a postpartum unit in a hospital. I recently accepted a new position working in an obstetrics and gynecology office where I hope to continue my career as a nurse practitioner. I am also a mother of 3 young children and have my own personal experience dealing with postpartum depression as well. Postpartum depression is a mental health condition that occurs in up to 15% of women within 2 to 3 months after having a child. Although it is more common to occur within the first 3 months, it can occur at any time following a pregnancy. Common symptoms include overwhelming fatigue and sleep disturbances, change in appetite, poor concentration, anxiety, feeling emotional or sad, and in some instances, suicidal thoughts. Many risk factors are thought to contribute to the development of postpartum depression. These include shifts in hormones after delivery, a lack of a support system, recent stressful events, and a history of depression or other mental illness. Postpartum depression is often underreported by women and therefore difficult to diagnose and treat. It is estimated that only 20% of mothers experiencing symptoms of postpartum depression will report it to their providers. This is often due to the stigma that is placed on mental health conditions and women feeling that they need to minimize their symptoms as a normal part of the postpartum period. The purpose of this study is to evaluate the effectiveness of the postpartum depression screening tools that are utilized, especially the Edinburgh Postnatal Depression Scale, which is one of the most commonly used screening tools. A sample is shown here on the screen. This screening tool asks women 10 questions based on how they have been feeling in the last 7 days and scores the responses accordingly to determine their risk for developing postpartum depression. Results from this study will help to increase providers' knowledge on postpartum depression and the importance of utilizing these tools for screening and diagnosis. This study will also address the most effective time to screen women for postpartum depression, as often women are lost to follow up in the postpartum period. By increasing the knowledge of providers and determining the most effective screening strategies, the goal is to improve the statistics on screening for postpartum depression and more accurately identify those at risk. The problem with postpartum depression is that it is one of the most common complications of childbearing, yet is extremely underreported and therefore undertreated. In just the United States, approximately 80% of women will experience some form of postpartum depression within the first 6 weeks following delivery. Approximately 1 in 7 women will experience postpartum depression in the first year after giving birth, which equals approximately 600,000 cases each year for those with live births in the United States. This number doesn't include the estimated 900,000 women annually that develop postpartum depression after a miscarriage or stillbirth. Professionals believe these statistics would actually be doubled with proper reporting and diagnosis. The goal of screening is to identify all these women plus the ones that are missed to close the gaps on diagnosis and treatment. Currently, screening for postpartum depression is not a standardized practice for hospitals, and women typically only have one follow-up appointment with their OB-GYN approximately 6 weeks after delivery. This quantitative study will be conducted in an OB-GYN office setting. The participants will be recruited through purposeful sampling by the nurses in the office. Information on the study will be provided by email and mailed letter, and informed consent will be obtained. To be included in the study, participants must be a pregnant woman, a patient at the practice, and 36 weeks pregnant at the time the study begins. Individuals will be randomly assigned to one of 4 groups. The control group will contain women that do not receive a postpartum depression screening tool at their 6-week postpartum appointment, but will still be asked by the nurse if they are experiencing any concerns with depression. 3 different experimental groups will be utilized. One group will receive the Edinburgh Postnatal Depression Scale at their 6-week postpartum appointment. One group will receive a different screening tool at their 6-week postpartum appointment, the Postpartum Depression Screening Tool. And one group will receive the Edinburgh Postnatal Depression Scale by email or phone call at 2 weeks postpartum, and then again at their 6-week postpartum appointment in person. A demographic survey will also be provided at everyone's 6-week appointment to allow for more statistics to be developed. For example, to determine correlations with those who have a history of postpartum depression, have multiple children, are low socioeconomic status, or have low levels of support. This study will provide information to nurses on the importance of postpartum depression screening tools, as nurses are usually the first providers to administer and review screening tool findings. Nurses are also considered frontline providers that spend a majority of their time in direct contact with patients and are able to identify concerns for possible postpartum depression. It is important for nurses to make sure that women are following up postpartum and receiving the screening tools to allow for early diagnosis and treatment. One of the biggest roles of nurses is advocating for their patients, which makes them the heart of healthcare. Findings from this study would help to standardize screening tools at the most effective time postpartum to identify more women who are at risk for developing postpartum depression. The overall goal is to increase the use of screening tools and have consistent use by providers so no one falls through the cracks. By having the screening tools in place and identifying more women at risk, the issues with underreporting and lack of treatment could be decreased. My proposal should be funded because there are so many women that are suffering from postpartum depression and many are not being diagnosed and therefore unable to be treated. This poses great health risks for both mother and baby. I believe as a nurse, screening for postpartum depression is such an important service to these women to help them receive the help they need. My own personal experiences with postpartum depression after all 3 of my children have increased my passion for this topic, as well as my nursing career working in postpartum in an OB/GYN office. I've spent my nursing career caring for mothers before, during, and after delivery, and postpartum depression and screening tools and treatments are one of my important job responsibilities. Thank you for your time listening to my proposal.